Do you know that breast cancer is the most common cancer in women worldwide? Every year, millions of the women are diagnosed. The good news is that early detection can save lives. Today, we will talk about the fact, the risk, and what women can do to protect their health. Hello, everyone, and welcome. Today, we are talking about breast cancer in women. One of the most important health issues affecting women around the world, especially during the 1980s and 1990s. One reason for this increase is better medical technology. Screening tools like mammogram made it easier for doctors to detect cancer earlier than before. Today, breast cancer is the most common cancer among women globally. Each year, about 2.3 million women are diagnosed. In many developed countries, approximately 1 in the 20 women may develop breast cancer during their lifetime. The highest diagnosis rates are often seen in North America, Europe, Australia, and New Zealand. However, death rates are often higher in lower income regions because the disease may be detected later and treatment options may be limited. Worldwide, around 670,000 women die from breast cancer each year. A healthy lifestyle plays an important role. Regular exercise, maintaining the healthy weights, eating balanced meals, avoiding smoking, and limiting alcohol can all help lower the risk. Another critical step is early screening. Doctors often recommending mammograms starting around the age 40 or earlier for women with a strong family history. The key message is simple. Awareness and early detection save lives with the right knowledge and regular medical care. Many cases of breast cancer can be treated successfully. Age, the most common risk factor. Age is the most significant risk factor for breast cancer. As people get older, the chance of DNA damage in cell increase. Over many years, these small changes can accumulate and lead to cancer. Most breast cancer causes are diagnosed in women over the age of 50. However, younger women can still develop breast cancer. Genetic mutations. Some women inherit genes mutation that increase the risk of developing breast cancer. The most well-known genes linked to breast cancer are BRCA1 and BRCA2. Normally, these genes help repair damaged DNA and keep cell healthy. When mutation occur, the genes may no longer function properly, increasing the likelihood that cancer cell will develop. Family history. Having close relative with breast cancer can increase a person's risk. If a mother, sister, or daughter has been diagnosed with breast cancer, the risk is higher than average. This can be due to shared genes, shared environmental factors, or similar lifestyle patterns. Hormonal factors. Hormones, especially estrogen, play a role in the development of some breast cancer. Long-term exposure to estrogen may increase risk. This can occur in situations such as starting menstruation at an early age, experiencing menopause later in the life, not having children, or having children later in the life. Radiation exposure. Exposure to high level of radiation during childhood or early adulthood can increase the likelihood of developing breast cancer later in life. For example, women who received radiation therapy to the chest area for other medical conditions when they were younger may have higher risk later on.
Breast cancer risk is influenced by many factors, including age, genetic, lifestyle, environmental exposure. While not all cases can be prevented, understanding the risk factors and maintaining a healthy lifestyle can play an important role in reducing risk and supporting overall health.